I am Laishram Divachanu, working as an associate professor in the Army Institute of Nursing, Guwahati. Would like to present a topic on the normal newborn. Most of the neonates are born naturally and are normal. Although it is normal during the process of birth, the baby has to face many physiological and environmental changes. Let us see the definitions of the neonatal periods. Neonatal periods is the period from birth till 28 days of life. So some characteristics of the newborn baby. Let us see what all these characteristics. During the birth, the head may have been elongated, that is made longer and narrower. The skin is blotched. The eyes are uncoordinated and the head seems too big for the tiny baby. A normal term babies weigh approximately 3.5 kg, that is 3,500 gram, and measures 50 centimeter in length, that is from the crown of the head to the heels. 33 to 35 centimeters, has an average occipitofrontal head circumference. So in the picture is showing there how to measure the head circumference. The newborn baby has almost no neck. The shoulders are narrow and sloping. The abdomen is large and protruding, especially after feeding. In proportions to the rest of the body, the arms and the legs are short and thin, and the hands and the feet are very small. They lies in an attitude of flexion with the arms extended. Their fingers reach upper thigh. So here in the pictures, we have seen that at the axilla there is white color sticky substances are present in this baby. So it is called a vernix caseosa. So let us see what this vernix caseosa means. Vernix caseosa is a white sticky substance present on the baby's skin at birth. The amount of vernix is variable. It is thought to have a protective function in utero, and after birth dries up and flakes off within a few hours. The umbilical cord's position on the anterior abdominal wall predisposes to its contamination from excreta. The sperm is rapidly colonized and necrosis and separated by a process of dry gangrene, usually within the first 10 days of. Downy hair called lanugo covers the skin and is plentiful over the shoulders, upper arms and thighs. The general colors of the skin depend on the baby's ethnic origins, ranging from pink and white to olive or dark brown. Another feature of racial origin is the Mongolian blue spot, which is present as a diffuse bluish-black area usually cover the sacral region. Dark-skinned babies become more pigmented in the first week of life through the palms of the hands, and the soles of feet remain paler than the rest of the body. Babies' bones are made up of mostly of cartilage or crystal. They are soft and flexible. The muscles are soft, small and uncontrolled. The legs muscles are less developed than those in the arms. Babies are often chubby. Soft fat covers most of their bodies. That's why while we are holding the baby, we should be very careful whenever we are handling the babies. So physiological changes. So in the physiological changes, after the birth of the baby, there are a lot of changes is occur in the newborn functioning parts of the body. Before the baby was born, in the life of the uterus, the baby blood is getting from the direct from the mother through the placenta, whereas after the birth the baby has to be survive as their own way. So there are a lot of changes. So let us see the changes. So changes will be explaining system-wise. So first let us see the respiratory changes seen in the respiratory system. So in the respiratory changes, the baby will initiate the breathing. So how this breathing was initiated? So there is some process for the initiation of breathing that cause the mechanical, chemical and sensory and thermal. These three processes create to initiate the breathing. So let us see about how the respiratory changes occur. So after birth, there are changes in the blood gases, that is increase in carbon dioxide and changes in pH of blood. The pH of blood is decreased. The extrauterine atmosphere has lower temperature. These mechanical, chemical and thermal stimuli initiate a breathing onset. Not only this, during the labor process, the chest of the fetus is compressed, which causes the removal of the fluid from the lungs. The lungs fluid is also removed by the lymphatic vessels and pulmonary capillaries. This causes the recoils of the lungs and the air enters the lungs to replace the lost fluid from the air passage. The alveolar epithelium produces a substance called the surface active phospholipid, act as a surfactant. This lowers the surface tension of the fluid and allows the air in the alveoli at the end of the expirations and prevent collapse of the alveoli. Thus, is respiration following the first breath requires less effort to alveoli are partially expanded. So like this, the baby initiate breathing and the lungs was expanded and the air was start the oxygen entering to the lungs and the alveoli. Next, let us see the circulatory changes in the cardiovascular system. After birth, circulatory changes occur because of shifting of pressure in the heart and great blood vessels. Once the lungs are expanded and inspire oxygen, dilates the pulmonary vessels. The pressure in the right chamber of the heart is increased. When the cord is clamped, it causes a progressive rise in the systemic vascular resistance. This increases pressure in the left chamber of the heart after birth. With the respiration and the increased oxygen, the changes of pressure in the heart causes the reverse of the fetal shunt. The blood flows from the higher pressure to the lower pressure. Therefore, when the pressure in the right side lowers and pressure in the left side increases, it causes the transitions of the fetal circulation to neonatal circulations. The main circulatory changes are the functional clauses of the fetal shunt, the foramen ovuli and ductus arteriosus and the ductus venosus. So these three are the main opening when the fetus is in the uterus. The oxygenated blood is getting from the mother through the placenta and directly it supplies to the heart, and from the heart all over the fetal's bodies the blood is getting. So these openings are very very important in the life of the fetus in the life of the fetus in the utero, whereas when the baby was born, this opening is no more required because the blood need to be purified in the lungs. So this opening is no more required. Slowly this opening will be closing when the baby was born. Next, let us see the blood. The neonate has blood volume about 90 milliliters per kilogram of body weight. The delay in clamping of the cord may allows more blood to the baby. Neonate's blood contains fetal red blood cells about 5 million per cubic milliliters. It has hemoglobin level about 80 grams per cent. White blood cell is about 20,000 per cubic milliliter. Next, let us see about the thermoregulation. At birth, neonate's temperature, that is the heat regulatory capacity, is deficit. The normal metabolic rate per unit of the body weight is twice that of the adult. The neonate's body surface area per unit weight is 3 times that of the adult. That is why the metabolic rate per unit of the body area is less than that of the adult. Exposure to environment causes more heat loss per unit of the body weight. Conservation of body heat is done by the layer of subcutaneous fat, brown fat. This brown fat is present around the neck, between the scapula and behind the sternum, and also flex positions of the chest. Fluid and electrolyte balance. The full-term baby neonate is composed of 70% fluid, whereas in adult it is only 58%. High level of sodium chloride and low level of potassium, magnesium, phosphate has contained in the extracellular fluid in the neonates. The rate of the fluid exchange in the neonate is much higher than that of the adult. The neonate has greater metabolism. This means the production of the acid is rapid and can develop acidosis rapidly. The neonate's kidneys are immature and are unable to concentrate the urine or to conserve the body fluids. The neonate has potential develops such as the acidosis, dehydration, or overhydration. Digestive systems. The neonate is born with sucking and swallowing reflexes. The neonate's stomach capacity is about 90 ml and emptying time is short, about 2.5 to 3 hours. Therefore, the newborn requires small and frequent feeding. There are rapid peristalsis and non-peristaltic webs along the esophagus and a relaxed cardiac sphincter, which makes the regurgitation common. The neonate fast stool is called meconium, which is sticky and greenish black. It contains the intrauterine debris such as bile pigment, epithelial cells, fatty acids, mucous bloods, and amniotic fluids. Passage of the meconium should occur within 36 hours after birth. 3 days after starting feedings, the color and the consistency of the stool start changing. Digestive systems. Continuations. The neonate's liver is immature. It stores less glycogen. Therefore, the neonate has the high risk of the hypoglycemia. So, should feed promptly. The activity of the glucuronide transferase is reduced. This affects the conjugations of the bilirubin and a glucuronic acid. It may cause physiological jaundice in the newborn. Prothrombin level is low and may cause bleeding. Next, let us see the renal system. The ability of the kidney to concentrate the urine is reduced. The neonate has able to maintain the fluid balance in cases of fluid overload or the fluid deficiency. The urine output on the first day is 20 ml. It is increases to 200 to 300 ml by the end of first week. The bladder capacity is about 15 to 20 ml, so the neonate may avoid 15 to 20 times during 24 hours. The normal urine of the neonate is colorless and odorless. Next, skin. The layer of the skin, the epidermis and the dermis, are loosely bound to each other and are very thin. The skin functions is not mature. The slight friction can lead to injury or blister. The fluid loss by the evaporation is almost comparatively more. Next, let us see about the muscular and skeletal system. The muscles are formed at birth. They gradually increase in size and develop. Bones of neonates are mainly of cartilage and are under the rapid process of ossification. The skull bones are soft and not joined. The membranes at the junction of these bones make soft frontinelles that gradually ossify. Next is the endocrine system. The endocrine system is almost formed, but its functions are not mature. The posterior pituitary gland produces an inadequate amount of an antidiuretic hormones ADH. Thus, the neonate is prone to develop dehydration if a fluid intake is not maintained. The effect of maternal hormone may be seen in the female neonates. These hormonal effects may be seen as the hypertrophy of the labia and an engorgement of the breast and milk secretions. The sudden drop in the level of the progesterone and estrogen may cause the pseudomenstruations in the female. Next, about the nervous system. Myelin is necessary for rapid and efficient transmission of impulses. Myelination of the nervous system occurs in the sequence from cephalocaudal proximodistal lobe. This development occurs first in the sensory, cerebellar and the extrapyramidal tract. Last one is the defense mechanism against infection. The skin and the mucous membranes protect the body and from enters of organisms. Phagocytic process of the bloods are present in the neonates, but the inflammatory response of the tissues to localized infection is not mature. The formation of the specific antibodies to an antigen is limited as the neonate is unable to produce its own gamma globulin. It has enough passive immunity received from the mother as the immunoglobulin A, that is IgA. So these all are about the physiological changes and the characteristics of the normal newborn. If we know all this, so it will be easy for us to handle the newborn baby at the time of assessment. Thank you all.